Please go to page 13. We're going to continue our discussion of joints and pretty much zoom in on the synovial joints. What we want to do is first characterize the different types of synovial joints and then actually look into selected ones of the body. Now, the first one we're going to talk about is the plane joint, and this has its actual derivation. You think about it, which you're moving in one aspect of a plane. You think of 3 dimensions. So here you're kind of moving in this particular plane, and if you do any woodwork, think of the instrument called the plane, because you shave off one level at a time, a particular layer or a plane. Anyway, these are very flat, so they kind of glide against each other. Look at the arrows, and this is where you get a gliding motion, and they're found in your intercarpal, so that's within the wrist, intertarsal, within the ankles, and adjacent vertebrae, so they're going to be swaying back and forth. That's a sliding-like motion. And this is the simplest type of motion in your body. Everything else can involve some type of angle. Here's a hinge joint, and we think about this like a door on a hinge that you could open or close it. It really has no other motions. These guys only allow flexation and extension. An excellent example is the elbow joint, and that's what you're seeing here. You got the ulnar, the trochlear notch, articulating with the trochlea, right? Your interphalangeal joints, so your fingers, they could bend and extend. Very little, now not counting the knuckle, but otherwise right at the finger itself, the digits, they could only flex and extend. And the knee. If the knee is doing any side-to-side motion, oh, you got some serious flexibility issues. But really, it should only flex and extend. See, now all of a sudden we get to see this bone, and hopefully can recognize all the different parts, but that's lab. We have to worry about it. What else do we have? We have the pivot joint. If you do dance, 1, 2, 3, pivot, and pivot's kind of a rotation. There's 2 good examples of that. Right here you can see our radial ulnar joint, and that's what allows us, if you think about it, do your supination or pronation. They kind of pivot on each other. You got a little, look at this, a little ligament here connecting bone to bone. Ooh, look at this. What's this thing over here? Ooh, looks like the radial tuberosity, a rough part on the radius, head of the radius, nice and round. That's how it allows it to pivot. The atlantoaxial joint is also a pivot joint, and that's a fancy way of saying the joint between C1 and C2, atlas and axis. Remember, no, and that's a rotational aspect. Halfway done of the 6 types of joints. Then we have what we call a condyloid joint. These are much more movable than the others, but not as freely movable as you shall see when we talk about the ball and socket. These are your knuckle joints. If you look at here, these are your knuckles, and your knuckles do have a lot of movement, but compare them, I try to move your ring finger as compared to your shoulder. It's still kind of connected to the other fingers, hard to move it really independently. The overall wrist, if you want to look at the wrist as a whole, kind of swaying it all around. If you're just moving back and forth, you're thinking of the gliding, but then when you're starting to kind of more moving it, kind of flexation and kind of moving some more bizarre rays, you're hitting more of the condyloid aspect. Those are the 2 main ways to think of condyloid joints, but the knuckles is probably an excellent way of looking at it. And you can see the full name of it, the metacarpophalangeal joint. So metacarpals with the phalanges. That's where the bones meet. The phalanges meet the metacarpals. Metacarpals here, phalanges here. Saddle joint. If you look at this, kind of looks like a saddle. And there's one good example of this, and this is your thumb. Good for thumb wars. And look at the motion of your thumb, move it around versus your ring finger. Thumb has definitely got a lot more action going for it. So this is the only example of a saddle joint in the body. Lastly is the ball and socket joint. And these are the most freely movable joints in the whole body. You got between the hip joint and the shoulder joint, and between the two of them, who's got the greatest mobility is obviously the shoulder joint, because what we gain in mobility, we lack in stability. Okay? So this is an overview of different types of joints. Now for the rest of this video, I'm going to talk briefly about some selected synovial joints, and the last video we'll talk about what happens when joints go bad. We got the shoulder joint. If you want to call it by its technical name, you have the glenohumeral joint. Gleno for glenoid cavity, humeral, well, for the humerus. Ha! You get it! No, never mind. It's the most movable joint in the whole body, but again, you have a lack of stability. It has this thing called the rotator cuff, which is a combination of various tendons and muscles that stabilize it. So if you ever hear of someone, that you have a patient that's had their rotator cuff torn, don't look at their knee. You'll embarrass yourself. And probably their arm would be in a sling, if nothing else, just to try to kind of immobilize the whole arm. So it can be torn. If you kind of look at it here, just looking at this picture, you can see a lot of our old friends. You got tendon sheaths, you got their acromion, and the coracoid process of scapula. Then look at this. Look how we name some of these guys. The coracoacromial ligament connects what? The acromion to the coracoid. So if you know the basic notions of ligaments and the bone and bone markings, and you start looking at these pictures, you get to see how we name things. The coracohumeral ligament goes from what to what? The coracoid process to the humerus. So, and it's always to the rough spots. That's why you have those rough tubercles and tuberosities. That's usually where you have ligaments or tendons attaching to things. Tendon of the... Okay, let's see anything else here. Subscapular bursa is below the scapula. Easy enough, kind of a little bit inferior. So that's the power of kind of learning how to name things, that when you all of a sudden you come with new names that you do need to know, it's based upon old things that have been whopped in y'all's head. Okay, so that's the shoulder. Then we have the hip joint. Sometimes we call it the coaxial joint. Again, you have a great, really deep socket. You have the head of the femur. Looks like, what's this? That looks like an epiphyseal line. Keep bringing those up. And then you have the acetabulum of the oscoxal bone, or the hip bone, though we really don't want to just call it that, which gives it great stability. And who is this? Ooh, that's obturator foramen. That's right. Fast one? Ooh, this region is the greater trochanter. Knee joint. It's the most complicated joint. It has these things called menisci, or meniscus singular. It's got fiber cartilage, and these guys, if mess up, can mess up your knees, and eventually you may need some prosthetics if your knee goes south. Well, actually, any joint goes south, but knees, it can happen to it easily enough. So you have a lot of fiber cartilage in these various menisci for shock absorption and stabilization, and to further stabilize and hold things together, you have these things called cruciate ligaments, and sometimes you may have heard someone saying they've ripped their ACL, anterior cruciate ligament. So if they say someone's got a torn ACL, don't look in their elbow, don't look in their shoulder. It's a knee problem. So you can kind of just go with it. And you can see the fact is, in a sports injury, if a hockey puck was to hit this, it'd be a lot of force all at once, and these guys could snap, because taffy can snap, and the stuff, these ligaments are taffy-like in that sense. They could snap or stretch, and either way they're messed up. Surgery can fix it.